Ladies and gentlemen, good afternoon. Thank you so much for being here. We're going to begin this press conference. It will be followed by questions and answers following statements. It's my pleasure now to introduce Dr. Christopher Hunter, who is Director of Medical Services for Orange County Government.
Hello, welcome everybody. Good afternoon. Welcome to Orange County Mosquito Control. I'm Chris Hunter. I'm the Director of the Health Services Department for Orange County. We oversee the mosquito control operations here for this community. With me today is Kelly Deutsch. She's the Acting Manager of the Mosquito Control Division. They've been hosting us today. And we're really excited to have special guests with us, and we're really happy to have you all here. I'm joined by Orange County Mayor Teresa Jacobs, by the U.S. Department of Health and Human Services Secretary Sylvia Burwell, and by the U.S. Surgeon General Dr. Vivek Murthy. Together, we're going to hope to discuss the visit a little bit with you and answer any questions you may have. And first, I'm going to ask Mayor Jacobs to come speak.
Well, good afternoon, ladies and gentlemen, and welcome to Orange County's mosquito control facilities. I'm deeply honored to be here today with Secretary Burwell, as well as the Surgeon General Murthy, as well as our outstanding Orange County mosquito control team. You know, providing health and safety for our community is job number one in Orange County. And so often, I think when people think of health and public safety, they think of fire rescue, they think of law enforcement officers, especially most recently, that's what comes to mind. But the team here at Mosquito Control is also a crucial part of our health and public safety team. And they are out every day looking for mosquitoes, testing mosquitoes. You're going to hear more about that in just a minute. Our team also works tirelessly with the Florida Department of Health and our federal partners to proactively combat the spread of Zika and other mosquito-borne illnesses. Already, we have tested more than 1,100 mosquitoes just in the last month and a half. Our mosquito control employees have been on the property of 7,200 property owners just in that same period of time. With the permission of the property owners, they've been inspecting and collecting mosquitoes and testing every one of them. I'm pleased to say that to date, we have not found a single mosquito carrying the Zika virus. Our field team is working, though, proactively to eliminate the sources of the type of mosquito that we're most concerned about, Aedes aegypti. And interestingly enough, these mosquitoes they will only reproduce in standing water that is not natural water, the type of water that we would have around our yards and things like flower pots and tires and things like that. So there's a lot that our citizens can do to help us in that arena to make sure that we are keeping the mosquito population under control. We need the help also of our federal partners. We have about a little less than 40 employees that are out doing this every day, and that's why we're so thrilled to be joined here today with our federal partners to talk about the role that all of us can play. You know, this takes a united community. It takes federal, local, state resources, but it also takes the work of every single person who lives in our community to stay vigilant and to watch their properties and to take care of their own personal protection. So now I wanted to invite to the podium, for a federal public health perspective, my pleasure, my honor to introduce an individual who I met a year ago who is working tirelessly on this issue, the Surgeon General of the United States, Dr. Murthy. Dr. Murthy?
Well, thank you so much, Mayor Jacobs. It is great to be here in Orlando. Florida is actually my home state, and so it's not only good to be back, but it makes me especially proud to see the great work that is being done here to address Zika and to make sure we are protecting citizens throughout this state. Now, there has been some misinformation in the past about Zika, and we are finding that not enough people know the facts about Zika. So I wanted to lay out a few key things about the virus from the get-go. The first thing to know is that Zika is a virus that's primarily spread by mosquitoes. And we've also learned, though, that the virus can be spread through sex. Now, most people who get the Zika virus do not have symptoms. And if they do, their symptoms may include fever, rash, joint pain, and red eyes. But whether or not you have symptoms, if you have Zika, you can still pass that virus on to mosquitoes, which can then pass it on to other people. The primary concern that we have about Zika is with regard to pregnant women, because when the virus affects pregnant women, it can cause birth defects, including one called microcephaly, which is a very serious birth defect. In a small number of cases, the Zika virus has also been shown to trigger something called Guillain-Barré syndrome, which is an uncommon but largely treatable illness of the neurological system, which can cause weakness and sometimes paralysis. Now, currently, there is no treatment or vaccine for the Zika virus. We are working hard to change that in partnership with scientists across the federal government, but that is an effort that requires time as well as resources. So how should we protect ourselves? Well, there are some key public health messages which we should all remember. Number one, if you are pregnant right now, you should not travel to an area that has ongoing transmission of the Zika virus. There are 50 countries and territories in the Americas which right now have ongoing transmission of the virus, and you can find a full list of these at cdc.gov/Zika. Second, if you are a man or a woman and your partner is pregnant, and if you have to travel to an area that has ongoing transmission of Zika, then you should avoid having unprotected sex for the duration of your partner's pregnancy. This is because we know now that the Zika virus can be transmitted during sex. And finally, everyone, whether you're pregnant or not, whether your partner is pregnant or not, should take steps to reduce the chances of getting bitten by mosquitoes. This means wearing mosquito repellent, and there are mosquito repellents that are safe for use during pregnancy that are EPA approved for this purpose. It also involves staying in air-conditioned spaces, wearing long sleeves and long pants whenever possible. And also, another step we can take is to ensure we're doing everything we can to get rid of stagnant water in our houses and in our neighborhoods. Many people think that the mosquitoes that we're concerned about breed in big lakes or the ocean. It turns out they're most commonly actually breed in artificial containers that are filled with water. These include bird baths, old tires that might be left in your yard, and things as small as a bottle cap full of water. Now, finally, if you are thinking about getting pregnant, and if you have any concerns about the timing of your pregnancy, I would encourage you to talk to your doctor about your plans, to talk to them also about the potential risk of getting Zika during your pregnancy, and how to minimize that risk both for yourself and your partner. If anyone has any questions at all about whether they should be tested for the virus, I would also encourage you to talk to your doctor to figure out whether or not you need to be tested and how to go about doing that. And finally, right now, we haven't yet confirmed that there is local mosquito-borne transmission of Zika in Florida or anywhere else in the continental United States. You are aware that there are 2 cases that are under investigation in Broward and Dade counties. But because of this, we have to keep an especially close eye on the situation, not just in Florida, but throughout the continental United States, especially in regions that are close to the Gulf region. If anyone has any questions about Zika, you can visit cdc.gov/Zika. You can also visit the Florida Department of Health website, which can give you tips whether you are a community member who's wondering if you should get tested, or whether you're a healthcare provider who's wondering what guidance to follow. And now it gives me great pleasure to introduce our Secretary of the Department of Health and Human Services, Ms. Sylvia Burwell.
Thank you, and I want to thank our host here at Orange County Mosquito Control. Thank you so much for having us and all the great work in public health that the team is doing here. And also, Mayor, thank you so much for joining us today as we come here to do a couple of things. And one is to make sure that we are ensuring that everyone has the information they need about Zika. And I think the Surgeon General just went, and thank you very much, Dr. Murthy, for going through a lot of the specific details that are important to people. A couple other things that I think are important for folks to know is that in the United States and the territories right now, we have 5,200 cases of Zika between the U.S. and Puerto Rico, and so quite a few cases. In terms of the number of pregnant women, almost 500 in the continental U.S. who test or indicate positive for Zika, and we've already had 12 births with negative consequences in terms of those birth defects that the Surgeon General was talking about. So a very serious issue that we want to make sure everybody has the right tools to be able to do what they can to protect themselves in terms of travel, in terms of sexual relations, in terms of making sure when you're in places you know the steps you should take. And today we're highlighting one of the very important steps that we take And that is local governments are at the point of the arrow of this effort, and that is vector or mosquito control. And today had the opportunity to see up close, firsthand, this work that is going on in a terrific way, and some of the best work that's going on in the country in terms of getting out there to make sure that people's homes and the areas that they live in are safe. And so highlighting the great work today and the partnership we have, we've been able to fund some of the work here today in this site, and we're excited about that. As a federal government, we are continuing on a number of efforts and issues. One is education and communication, and the Surgeon General did a lot of that in his remarks. Number two is working hard on controlling the mosquito and supporting those efforts that are happening in communities across the country, and this being a great example of stellar work that's going on. And number three, making sure that we are doing the research that's needed to improve the tests, the diagnostics that tell you if you do or don't have Zika, the research about this disease, because there are many things that aren't known, and the very important research on vaccines as a way that we can prevent people from getting it, especially those women who want to become pregnant or are pregnant. And so all of that work, we are continuing to work at the federal, state, and local level together in partnership, and all of that work is going to continue forward. We do need the resources to do that. As you all probably know, we asked for those resources in February, and we are now at a point where we are in peak mosquito season, as well as the fact that we have good news with regard to first stage of vaccine candidate. It takes a while for that process to go, but we're in a good place there. But we don't want to slow that research down at all, and without funds we would have to. So here to highlight the great work that's going on, talk about making sure people have the right information and know the work that we're going to do to go forward to make sure we're protecting the homeland here in the continental U.S. and Hawaii, as well as Puerto Rico too. And with that, we welcome any questions. I think any of us are happy to take any questions from the press.
Secretary, how worried should we be that Zika will get into our local mosquito population here in Central Florida?
I think that what you should be worried about is that some sort of local transmission will occur in Florida this summer. That is our expectation. We don't know when or where. As Dr. Murthy mentioned, there are 2 cases in the Broward and Dade area where those mosquitoes and those cases it's been undetermined whether those are local transmission, but we expect that. If the disease follows the trajectory of chikungunya and dengue, which here in Florida you have experience with, we would expect those cases to have limited numbers in terms of that. But we are being extremely careful until we know for certain. So right now, the state has invited some of our folks from the Center for Disease Control and Prevention to come in, and we have a person on the ground working on the mosquito issues with the local communities. The communities, like our folks here that we're visiting today, lead with support from the Center for Disease Control and Prevention in the federal government. Yes. Yes. You want to speak to it?
So great question. So the question was about mosquito repellents. There are a variety of mosquito repellents that are EPA approved and safe for use in kids and adults, and including in pregnant women. Some of these contain DEET, others contain picaridin. There are actually a full list of these that you can find at the CDC website, cdc.gov/Zika. The reason we want people to know this is we want to make sure each and every person can take steps to protect themselves from mosquitoes and therefore from Zika. Yes, and it should be used in the appropriate dosages as indicated on the canister, but yes.
We have an 8- and a 6-year-old, and we use it.
Secretary, Congress went home for the summer without providing the funding that the Obama administration requested to do the research necessary for a vaccine for prevention. Did they handicap your efforts, and what can Florida expect in terms of additional funding to fight this?
So right now, in terms of funding for Florida, we have made it possible for Florida to use $27 million in public health emergency funding that you had to use all of those funds for Zika if that is what the governor determines is best for the state. In addition, you probably saw that last week we moved $60 million across the country in grants, and Florida, they were recipients of that grant. I think Florida's was about $5 million. We have moved all the money that we can at this point in terms of moving our money around to try and cover. As we said at the time before Congress went out, we are at a point in time where we need the resources, and very clearly we will run out of money in our vaccine efforts. And those vaccine efforts, the private sector is an extremely important partner in doing the vaccine efforts, and so we need to have the capability to tell the private sector partners, yes, we're going to fund our part. And that uncertainty is leading to a situation where a number of private sector partners are telling us they won't be willing to go forward. So this will, we hope, be a very important priority the moment that the Congress gets back in September, because we don't want to slow it down. The idea that you're going to slow down the vaccine, which in the end, it will take time to get there, but any month delay in terms of getting us to the seasons and making sure that we have that tool for any woman and anyone trying to prevent Zika and trying to prevent a pregnancy that could result in a negative birth defect. Yes.
Secretary, how would someone know if they've been bitten by a mosquito that they might have the virus? Are there any symptoms? There's very little symptoms.
So about 80% of the people do not have symptoms, and that's why it's extremely important, especially here in Orlando, where you have many travelers coming from the 50 places where the mosquito is passing it. When those travelers come back, no matter if they are symptomatic or not, they should, for 3 weeks, take the steps that Dr. Murthy outlined. Long sleeves, insecticide, screens, as well as air conditioning, and taking those steps. And the reason is you'll have it, if you have it, you'll have it in your blood. In terms of the symptoms, so 80% approximately don't have symptoms. For the 20% that do have symptoms, those symptoms are joint pain, fever, potentially rash, and pink eye, what people think of conjunctivitis or pink eye. And so any combination of those are things that you should be aware of. But it is very important for people traveling to those regions who come back to be careful, because you don't want to be the person who traveled, was not symptomatic, the mosquito bites you, and then bites you and passes. And so that's why we want to emphasize that, even if you don't have symptoms.
Have you been briefed on the investigation in Broward and Miami? Can you share anything new with us about that?
You know, we don't have anything new to share in terms of that. We continue to work with the counties over the weekend, and the teams are continuing to work. As you know, in terms of definitive nature, there's mosquito trapping, there are questions, there are a number of steps that the county is going through, and we're supporting them in that work, but nothing new to add at this point. Yes.
Does the federal government have an idea of how quickly this could spread? If these 2 cases are confirmed, are we looking at months, years, that Zika could be spread not only from South Florida to Orlando, to the rest of the United States?
So the work that teams like this one do here is to make sure that if there was a case of local transmission, and this team I was just briefed on, even for the cases that are travel related, the team here is doing the work around those homes and in those communities to make sure that they try and stop that spread. And so that's what's happening. That's what's happening in Broward and Miami-Dade in terms of going out in the area that you think is that, to stop it so that you have a limited number of cases if you do have a case of local transmission. What we want to do is prevent it as much as possible. That's why I'm focused on this 3-week period for everyone. But if you do have a case, then using the vector control and the careful nature of individuals to try and prevent further spread.
Can you comment on the new CDC guidelines that came out this morning for caregivers when it comes to the Zika virus?
Yes, it is emphasizing the importance of following some of the existing guidelines with regard to caregivers and making sure that if there are people with very high viral loads, in other words, if you are caring for someone who is very sick with Zika, to take the regular precautions that you need to take. And so also that's been emphasized. CDC has had guidance out for a long time with regard to pregnant and delivery, because during that period of time there are many fluids, and it can often be a long period of time, and making sure that our healthcare providers are wearing the appropriate things that they need to wear. And most of those are actually quite common and what they do in standard procedure, but we want to emphasize it.
What about the rural areas? You know, we were talking about Orange County and Miami-Dade that are a little bit better funded. What if we start seeing cases that maybe are coming into areas that don't have the kind of resources that Orange County and Miami-Dade have?
So it is an important point, and this is a very important part of what the funding would be used for in terms of if we get the funding from Congress is getting basically a vector control best practices effort that can spread things even more quickly to communities like that. For those communities, we have been working across the states, and 30 of the states joined with the CDC to put in place plans for their states, and that included plans for places like this, but also the rural parts of the states in terms of how they would handle. The other thing that I think is important is CDC, the Center for Disease Control and Prevention, we stand ready with emergency teams that we will fly in that have a number of pieces and parts to support teams like that in a rural community that may not have all the resources. We become the legs in terms of doing some of that work and supporting the community. The community will always maintain the lead, but we become the help and support. And those teams are ready. We sent a person, because that's all that was needed at this point in time, to Miami-Dade and Broward. We've also sent the team in Utah. I think you all may know about a case out in Utah that is under investigation as well. And so we sent it's called a CERT team, an emergency response team, and that has gone out. And so we'll look if anything happens in a rural area, we are ready to respond. We have those teams stood up and standing on the ready to go. I think the lady in front, and then we'll.
I actually just have a question for the mayor. So
Great. I'm going to let the mayor take over here.
I know that feeling. You've been doing a great job. Yeah. Go ahead.
Mayor Jacobs, talk a little bit about the cases in South Florida. Are you concerned about if there is a case? I mean, this is all hypothetical.
Mhm.
But if there is a case in Orange County and in Central Florida here with a public tourism, are you worried that it's going to affect our tourism industry?
Well, certainly that's on our minds in terms of what will be the reaction of our visitors coming here. I think education is the key to helping people understand what the risks are, not to overreact, but to take the proper precautions that we've been talking about here. One thing that I think is interesting to understand about this is it is not going to move from Miami to Orange County by mosquito. If it comes here, it will be by human beings that come here. So the mosquitoes don't travel very far. This gives us a little bit greater control as we monitor our mosquito population. But I think it's going to be important that we put out accurate information. That's one of the reasons that we're here today. We want to make sure that the public is well informed of what's being done, what precautions are being taken, what everyone needs to do. You all are we're talking to you, we're talking to the public, and your role is crucial as it is in any public safety issue.
With $5.6 million promised, are we looking at new equipment, more staff, all of the above?
And let me, if I could, we have our acting manager of mosquito control. She's been acting for 6 months, and she's acting really well. And she doesn't know it yet, but with board confirmation, she's going to be our manager very soon. So, Kelly, why don't you talk to us for just a minute about what you most need, because I think the biggest limitation she has is staffing.
Yeah, staffing is definitely number one issue for us because it takes a lot of time and effort to go door to door to teach people what they need to look for and also remove sources that they may have in their yards.
Okay?
Time for one more?
One more.
How worried should I be about Zika virus, or is it primarily women who are pregnant that should be the most concerned?
I think everyone should be alert and worried enough to take the appropriate precautions. And if you're asking the question you personally, it would be a series of questions that I would ask that would probably get too personal for a press conference to understand the answer to that. But I think what's important for everyone to know is this is the responsibility of all of us because it is a public health issue, and how it will spread is mosquitoes biting. These mosquitoes sometimes bite 4 people in one meal. In terms of this, it's an indoor mosquito. And so that, and the other thing that's extremely unusual and why I believe everyone should be a part of being careful is that it is sexually transmitted. And that's a very unusual thing that we had not seen before. And so that means that we all need to be on alert in terms of the passage of that. And clearly in terms of if you travel to that region, any of those places, making sure, as we discussed in the one question the gentleman asked about, for those 3 weeks after, making sure that you're taking appropriate steps. And the other thing you can do is empty your water, the standing water that you've got around your home or in your home. As Dr. Murthy said, this mosquito can breed in a capful of water. So making sure you're doing everything. So it's something I think we all own, especially during this peak season here in places like Florida and all across the coast in terms of it. We're doing everything we can, including, in Puerto Rico, all of the blood is screened. In terms of making sure it doesn't get passed that way. And we're putting in place those mechanisms so if something does happen here in Florida or Texas or Louisiana or Mississippi, that we can put those things in place. But I think everyone should be alert, understand the facts, and do what they can to prevent it. Thank you.
Before we wrap up, if I could have one last opportunity regarding your question about our visitors, I do want to reiterate one thing that I think you all know, and that is our theme parks have very extensive mosquito control procedures already in place. They do constantly. Whether we had this situation that we're currently looking at with Zika and other countries, mosquitoes are a nuisance. And for our visitors, we don't like them to experience nuisances. So our hotels and our theme parks are extremely vigilant and have been, and they have increased that vigilance when it comes to the mosquito population. So what do people think? We'll have to work on making sure people have the facts, but I think our theme parks are probably the safest place on the planet when it comes to mosquitoes. Thank you.